Hi, I'm Joe Graedon.
And I'm Dr. Terry Graedon. We host the People's Pharmacy on public radio, and we write the syndicated newspaper column.
You may find this hard to believe, but one of the reasons people come into the pharmacy most often is constipation. Now, that's because they believe that regularity is essential for good health. But what's regular?
Well, the problem is a lot of people have been told they have to have a movement once a day like clockwork. The fact is that some people go 2 or 3 times a day, and that's normal for them. For other people, normal is 2 or 3 times a week.
Now, when it starts to be uncomfortable, bricks, pain, then you do want to come into the pharmacy and find something to get your relief. But diet sometimes works just as well.
That's right. Probably the best place to start is fluid and fiber in the diet. You want to look for foods that are high in fiber like apples or bran, broccoli, or barley.
But if that doesn't work, what should you pick? There are so many products to choose from, and it's sometimes a little bewildering. A lot of people worry about a laxative habit. You can get into a vicious cycle if you start taking these every day, day in and day out.
But that won't happen with fiber. So we suggest you start with fiber, and there are a lot to choose from.
There's all kinds of fiber products. Now, if you don't like stirring it up and swallowing that liquid stuff, you can just buy wafers. Easy to take, especially if you're going on a trip. Next, we kind of like stool softeners. This would probably be our #1 choice in the pharmacy. Colace is a familiar brand, but there are lots of house brands that work really well too.
And one other product you might not think of with respect to as a laxative is sugarless gum.
Yeah, it's surprising, but sugarless gum, just a couple of pieces, a couple of times a day, attract fluid to the digestive tract and can solve almost the worst constipation problem, especially when you're going on a trip. But don't overdo.
No, too much could cause diarrhea.